Hey everyone, and welcome to this explainer. Today, we're going to unpack a massive, literally $5.6 trillion puzzle, U.S. healthcare economics. We're going to look at how a fundamental shift in how we actually pay our doctors and hospitals could quite literally save the entire system. Honestly, it's a topic that impacts absolutely every single one of us, our health, and for sure, our wallets.
We've structured this explainer into 5 pretty straightforward sections. We'll cover the U.S. healthcare paradox, fee-for-service versus value, how value-based care actually works, measuring real-world success, and finally, we'll look at the future of healthcare.
Okay, let's dive right into Section 1, the U.S. healthcare paradox, high costs, mixed outcomes.
To figure out the cure, we really need to understand the symptoms first, and, well, they're defined by some truly staggering numbers. The U.S. spends a massive $13,432 per person on healthcare. That is more than double the $6,514 average of the rest of the G7 nations. Now, you would naturally think that spending double means we're twice as healthy, right? But the data actually shows otherwise. Despite leading the world in things like medical innovation, the U.S. really underperforms in managing chronic conditions. Just as one example, we have nearly 2.5 times higher hospital admissions for diabetes compared to our peer countries.
But what's truly mind-blowing is where a huge chunk of that money actually goes. An estimated 25% of total U.S. healthcare spending is considered pure waste. By 2025, that represents a whopping $1.4 trillion. That waste comes from overtreatment, pricing failures, fraud, and just a massive amount of administrative complexity. We're essentially pouring over $1 trillion into a leaky bucket.
And on a macroeconomic level, the disparity is just massive. Our healthcare consumes 16.7% of our entire gross domestic product. Compare that to just the 10.8% G7 average. Healthcare spending growth is actually projected to outpace average GDP growth over the next decade, which is placing a completely unsustainable burden on the economy and eating up resources that could go elsewhere.
So the crucial point we have to ask ourselves, the big question that bridges the gap between all these wild numbers and our everyday reality is, why exactly do we pay so much more for worse outcomes? What is the structural flaw here?
To answer that, let's move right into Section 2, fee-for-service versus value, identifying the root cause. Because in healthcare, how you pay dictates exactly what you get. The long-standing culprit in the U.S. is the fee-for-service model. In this traditional system, providers are compensated for every single test, scan, and procedure they perform. It practically incentivizes a huge volume of costly services, completely regardless of the patient's actual health outcome. Think about it. If a doctor orders 10 tests, they get paid for 10 tests, even if only 2 of them were actually necessary.
So while fee-for-service drives a lot of fragmentation and waste, value-based care flips the script entirely. It rewards providers for keeping you healthy. It places a huge emphasis on primary care, prevention, and really integrated collaborative care across your whole medical team. Basically, it links payment directly to performance and effective care.
Now, changing a multi-trillion-dollar system is incredibly hard, but shifting away from fee-for-service is not a partisan issue at all. As former President Obama noted back in 2016, the goal is to move toward a model that rewards quality over quantity, focusing on giving folks the right tests and treatments to actually deliver better outcomes.
And similarly, President Trump in 2019 issued an executive order emphasizing the exact same need to link payment to value to protect Medicare's fiscal sustainability. This illustrates a rare decades-long bipartisan agreement. Both sides of the aisle recognize that the current payment structure is fundamentally broken and that value-based care is the path forward. So, everyone agrees on the concept. Let's move to Section 3, how value-based care works, the treatment plan.
How do we actually define and measure value? Well, the system relies on standardized metrics, often using something called the STEEP framework. This ensures care is safe, timely, effective, efficient, equitable, and patient-centered. In a value-based system, a doctor's payment is literally tied to their performance on metrics within these specific categories. It holds them accountable for the actual health outcome, not just the services they rendered.
Now, let's move on to Section 4, measuring real-world success, the clinical trials.
So how are these alternative payment models actually performing in the real world today? When we look at the data, we see exactly where this transition is happening the fastest. Medicare Advantage plans, which are private managed care plans, are completely leading the charge. A massive 64.3% of their payments are flowing through these alternative value-based models. Compare that to just 42% in traditional Medicare. These managed care plans have a direct financial incentive to keep patients healthy so they can avoid massive future hospital bills, and they're using value-based payments to make it happen.
And you know what? The data shows these accountable care organizations are working. The Medicare Shared Savings Program is the largest of its kind, and in 2023 alone, it yielded a massive $2.1 billion in net savings to Medicare. What's even better is that while they were saving all this money, these organizations also improved performance on key quality measures like diabetes and blood pressure control.
However, it's definitely not all easy wins, and we need to be realistic about the challenges here. The Center for Medicare and Medicaid Innovation, or CMMI, has been testing these models since 2010. Out of over 50 government-funded models they tested, only 12 produced statistically significant cost savings, and out of those, only 4 were successful enough to be expanded nationally. It really proves that designing these systems, getting the benchmarks right without penalizing doctors who take on sick patients, requires a ton of complex trial and error.
That brings us to our final section, the future of healthcare, the prognosis.
Based on all those trials, researchers have zeroed in on 6 key drivers of success. The absolute most crucial one, downside risk. Basically, models work best when providers have actual skin in the game. If they deliver inefficient, wasteful care, they need to actually lose money. It can't just be about getting bonuses for good care. There has to be real accountability. They also need proper alignment so doctors aren't just drowning in different reporting requirements. Plus, robust data support so they can track patient health effectively.
Going forward, this transition is going to be accelerated by massive market forces. Over 160 million Americans get their insurance through their employers, and those employers are finally stepping up and demanding better outcomes for their workforce. On top of that, the integration of evolving digital technologies, especially AI, is going to be absolutely pivotal. AI can optimize clinical workflows, reduce medical errors, and dramatically cut down the administrative waste that we learned earlier makes up a huge part of that $1.4 trillion in wasted spending. So, if you take one thing away from this explainer, let it be this. The framework for a sustainable, high-quality, and highly efficient healthcare system absolutely exists, but realizing it requires a complete, system-wide shift away from paying for volume. We have to fully 100% commit to paying for value.
I'm going to leave you with a provocative thought to chew on the next time you visit a doctor or the next time you open up a medical bill. Ask yourself, how is your own healthcare currently being billed? Are you paying for the sheer volume of tests and procedures, or are you actually paying for the value of your health? And ultimately, who in the current system is truly financially invested in keeping you healthy? Thanks for joining me on this explainer, and definitely keep asking the right questions.